Welcome back to sqadia.com. My name is Mohammad Osama, and today we are going to talk about environmental pathology. The first topic that we're going to cover in this series of lectures is physical injury, and specifically we are going to talk about the mechanical injuries in the type of physical injuries. So we are going to look into the types of physical injuries, which are mechanical injuries, cause of death, and specifically gunshot wounds. So there are different types of physical injuries. It can either be mechanical injury, thermal injury, electrical injury, or radiation injury. In this specific part of the lecture, we are going to talk about mechanical injuries in detail. So what is mechanical injury? An injury caused by application of physical violence or physical trauma to the body is known as mechanical injury. Now there can be different types of nature of trauma, and they can result in different type of mechanical injuries. The most common terms that we use or we listen to or what we look at regarding mechanical injuries are abrasions, lacerations, incisions, punctures, and contusions. So let's start off with abrasion, which is also known as scrap. Abrasion is actually a superficial injury, which is a superficial tearing away of the epidermal cells, as you can see in this picture. The second one is laceration. It is a jagged, irregular tear, often accompanied with stretching of the underlying tissue, as you can see here. On the other hand, incision is somewhat similar to laceration, but it is a sharp and clean cut with clearly defined borders, as if it was cut by a very sharp object, as you can see in this picture. Moving on, we also have another type of injury which is known as a puncture injury. It is characterized by deep tubular wound produced by a sharp, thin object, for example, a needle or a nail. At the end, there is contusion, which is a bruise caused by disruption of underlying small blood vessels, resulting in this type of appearance. It commonly involves skin, but contusions can also involve other organs, such as cerebral contusions in coup and counter-coup injuries. Now moving on, let's talk about the cause of death secondary to mechanical injury, that how death occurs in response to mechanical injury. So it can either occur because of hemorrhage and blood loss, or either there can be a complication of mechanical injury leading to fat embolism, which usually occurs because of bone fractures. It can also be because of the ruptured viscera, and that rupture of the visceral organs can lead to death as well. In the long term, or in a slightly long term, mechanical injuries can also lead to infections, and those infected diseases can also become the reason for death. It may not be immediate, but it can lead to death. Then another type is the renal shutdown, which is caused by the tubular necrosis in the kidney. Now there's a specific type of mechanical injuries which are blunt force injuries. So they are composed of, for example, head injuries, abdominal injuries, thoracic injuries. So let's start off with the head injury. So the different type of injuries can, or different type of responses can occur due to such a trauma or a head injury, which can either be brain damage, brain laceration, or brain contusion. Brain damage usually occurs in combination or association with a possible skull fracture. It is usually a direct result of cerebral trauma or caused by intracranial hemorrhage. Intracranial hemorrhage is actually the bleeding because of the disrupted blood vessels into the brain or inside the cranium. The second is the brain laceration, which is caused by fracture with penetrating injury by the fragments of the fractured skull. And then third one is the brain contusion. It usually manifests as a coup counter coup mechanism, which we are going to look at in the next slide. So first of all, here you can see that different types of hemorrhage can occur. For example, here we have epidural hematoma, which is outside the dura, and here we have a subdural hematoma, which is between the layers of the dura, and here we have the subarachnoid hemorrhage, which is into the parenchyma of the brain beneath the subarachnoid dura or subarachnoid matter of the dura. Here we can also see that this is also an example of our picture that is showing subarachnoid hemorrhage, and here we can see that these three different type of hemorrhage or hematoma by clearly differentiating the site of the bleed, and that would have a difference in symptoms. The second thing that we looked into was coup, counter-coup mechanism of injury, which can result in contusion of the brain. So what is coup injury? For example, if someone's head or skull strikes a fixed and rigid object, so because of the acceleration of the skull, the same side of the brain gets the contusion at this, or the side of the brain gets the contusion at where there was the collision or injury, then that is known as the coup injury. And if, for example, in case of whiplash, there is an injury or contusion of the brain on the opposite side of the impact, then that is known as a counter coup injury. So it is not necessary that the brain would have a contusion on the side of the impact. It can also be visible. It can also occur at the opposite side of the impact. Abdominal injuries are either in the form of contusions or rupture of visceral organs, such as rupture of spleen and liver, which is common in road traffic accidents, especially road traffic accidents in which the person is riding a motorbike. And rupture of intestines can also occur, which would result in peritonitis, which is the inflammation of the peritoneum. And thoracic injury. In thoracic injury, there can either be rib fractures because of that traumatic force and the traumatic impact, possibly with penetration of those fracture segments into the pulmonary parenchyma or thoracic vessel walls. Other than that, hemothorax and pneumothorax can also occur. Hemothorax is actually the hemorrhage or the disruption of the blood supply and loss of blood into the pleural cavity. And pneumothorax is actually because of the puncturing of the pleural cavity, because of which the air comes inside the pleural cavity. So here in this picture, you can see that this is a pneumothorax in which the air has entered into the pleural cavity, and it is thus trying to compress the lung parenchyma. Whereas in this part of the picture, you can see that there is hemothorax, which can also lead to pneumothorax. So this is actually also compressing the lung parenchyma because of the entry of the blood into the, or the bleeding into the pleural cavity. So as you can see, thoracic injury here, you can see that the fractures of the sternum or the ribs can occur, and it can also involve the lung parenchyma if the fragment of these fractured bones pierce the pleura and then the parenchyma. So here you can see in this picture in which that trauma has extended up till the heart and the lung parenchyma as well. And there's also a bruising and laceration of the liver. There's rupture of the heart, aorta, and pulmonary artery. So the heart is also involved, and multiple punctures and contusions of the lungs with hemothorax bilaterally because of those fractured segments from the ribs or the sternum. Another type, which is a common type of injury which we see in trauma, is a knife stab wound, which involves incisions and puncture wounds, depending on how the knife was used to elicit the injury. And it is a highly variable consequence depending on the site of injury and how the knife stab was performed. And different type of injury, which is actually a gunshot injury or a gunshot wound, is occurred when the bullet enters or strikes any body part. So whenever there is a gunshot wound, there is an entry point or entry wound, and there may also be an exit wound. So in that case, when there is an entrance wound and exit wound, on the inspection you would observe that the entrance wound is always smaller, and more well-defined and round as compared to the exit wound. And sometimes it is even smaller than the bullet itself because of the elasticity of the skin. Secondly, exit wounds are significantly larger than the bullet as well as the entrance wound, and that is because of the tumbling of the bullet. And the exit wound is usually irregular in shape, not well defined and round like an entrance wound, and stellate like a star shaped. And in contrast, wounds there in contact wounds in which the gun is in direct contact with the body part, so that is a contact wound. In contact wound, there may be burning around the margins of the wound, which is also known as or called as abrasion ring, because when the gunshot is fired, it's very hot. The bullet is very hot, and the gun is also very hot. So in contact wounds over the skull and skin closely overlying the bone may demonstrate a stellate appearance because of the disruption of the bone, and as compared to a normal entrance wound, which would be smaller and rounder as compared to contact wound, which would be stellate in appearance. On the other hand, close range wounds, what are the close range wounds? Which are 20 inches or less in distance from the gun and the site of impact of the bullet. So they demonstrate unburned powder particles in the skin and deposits of soot as well. Whereas long range wounds greater than 20 inches, they do not demonstrate any powder particles or soot, and they are usually round and oval, demonstrating clear margins without evidence of stipping or fouling or soot or unburned powder particles. So that was all about the mechanical type of physical injury, and in this we talked about the different types of injuries, the causes of death, and as well as gunshot wounds. So please stay tuned to sqadia.com so that you can look into the other parts of this lecture as well. And this is Mohammad Osama. Thank you very much for watching. Keep on watching sqadia.com.